This is Suzanne, and I'm going to be talking to you about cirrhosis of the liver. The purpose of this is just to teach about the pathophysiology of cirrhosis, the epidemiology, and the mortality, or the morbidity. Liver, it's the largest organ in the body, as you can see here. It's the largest organ of your body, and it's approximately the size of a football. It functions, they're vital to life. You cannot live without one. You have to have your liver. It does metabolism, digestive, metabolic detoxification, vascular function, hematological function, and immunological functions. It's an amazing organ that does all those things. The metabolism that it does is the age red blood cells that your body gets rid of every 90 days. It takes those by phagocytes and makes a byproduct of bilirubin. That bilirubin is excreted in your kidneys. Digestive function, it secretes 700 to 1200 milliliters of bile every day, which is not necessary for digestion. Metabolic detoxification, when you take drugs, even Tylenol, your liver breaks that down, and it's very important. You have to have a liver to do that. Vascular function, the liver stores blood. It can maintain some systemic circulation for a little while if you had a massive bleed for some reason, because your liver does store some blood. And immunological function, the Kupffer cells are phagocytes and they engulf bacteria. I've got a patient in the hospital actually now. She's in end-stage cirrhosis disease. She's had infection after infection, and it's related to the fact that her immunological function of her liver is compromised. Cirrhosis is defined by the Mayo Clinic as scarring of the liver. Liver damage is irreversible, and at this point there is no cure. What causes cirrhosis? There are 6 different hepatitis, A, B, C, D, E. Right now what we're going to talk about is hepatitis B and C, because both of those cause cirrhosis. Excess alcohol intake, autoimmune disorders, hereditary disorders, metabolic disorders, hepatic venous outflow obstructions. The hepatic venous outflow obstructions could be something like your biliary, if you get bile stones, things like that. Hereditary metabolic disorders, cystic fibrosis, different things like that could cause that. Non-alcoholic steatohepatitis is NASH, and that you see that with patients who have extremely elevated levels of triglycerides. Those guys, I've actually had a patient that was about 35 who was in liver failure because of his, he had a cholesterol triglycerides over 1,000. So this person had diabetes, elevated triglycerides, and he wasn't even obese, but usually the triad is obesity, diabetes, and high elevated cholesterol. Again, you'll see that NASH with that. Hepatitis B. Estimated 1.2 million people have chronic hepatitis B. Its contact is from semen, blood, any other body fluids. Actually, hepatitis B can live outside of the body. I believe hepatitis B lives outside of the body for 7 days, and hepatitis C is 4 days. Persons at risk: infants to infected moms, sex with an infected person, a person that has multiple sex partners, men who've had sex with men, IV drug users, healthcare and public safety workers. Any healthcare provider needs to have the hepatitis B vaccine. They would get it over a period of 3 doses over 6 months. Again, this is prevention. You could prevent from getting hepatitis B and ultimately end-stage liver disease from cirrhosis just by getting the hepatitis B vaccine. Babies now are required in the state of Georgia to also get hepatitis B vaccination, and this is the reason because they can become infected early as a child and have a lifelong chronic liver disease. Hepatitis C is the leading cause of cirrhosis and liver cancer. Contact, again, it's blood-to-blood contact, IV drug users, any blood-to-blood contact, and there is no vaccination at this time to prevent hepatitis C. Tattoos, we see a lot of this from men that get like the tattoos in prison. sex in prison, those type of things. A lot of prisoners. One of the studies I read, they did a study actually in the state of Georgia about the prisoners that came in, didn't have hepatitis, and then when they left the prison they did have hepatitis. It was quite a alarming number. Alcoholics did have hepatitis. It's where the liver converts alcohol to acetaldehyde. Excessive amounts of acetaldehyde alters your metabolism of vitamins and minerals. It provokes liver becoming hard and fibrotic. It causes cellular damage. Those cells are damaged over that alcohol, in the liver over a period of time constantly. That cellular damage is going to cause ascites because the fluid that normally flows throughout those vascular channels is now damaged because they're hard and fibrotic. The blood supply can't get through. The bile, the 700 to 1200 milliliters that it's producing a day, cannot get through. So that's causing ascites, and that's when you're going to see the abdomen that's, they're going to need their abdomen, that peritoneal, where they go in and take the fluid off. They're going to need that. Portal hypertension, this is where the blood flow is the damaged veins and arteries because the liver gets support from arterial and venous blood flow. And what happens is it's so damaged that now the blood's backing up. And then when the blood gets backed up, you got portal hypertension, then you got hepatic encephalopathy. That happens when the ammonias, those toxins that your liver can't detoxify anymore, are building up and they go to your brain. Hepatic encephalopathy, this is the guys you see coming in the ER that are 50 years old. They're confused, disoriented, they're just totally mentally altered at the point, and long history of alcoholism. They present impaired cognitive function. You'll see EEG changes and a stereotyxis, which is a tremor of the hand when the wrist is extended. The ammonia begins to reach the brain, and it's metabolized to glutamine, alterations of the cerebral blood flow. Anytime you alter the cerebral blood flow, that's never good news. Your brain needs the blood flow. Treatment for that is lactulose to prevent ammonia reabsorption in the colon. Again, they don't want to drink that. It tastes terrible, and they have lots and lots of diarrhea. So those patients are pretty miserable taking that. Rifaximin decreases intestinal production and absorption of ammonia and correct the fluid and electrolyte balances. They're going to have to be in the hospital usually for a week or so to get this corrected, and then unfortunately it's a repeat cycle over and over. Again, the non-alcoholic fatty liver disease, it's basically, we talked a little bit about it earlier, it was about the fat, the triglycerides are infiltrating the liver. Those at risk are individuals with hyperlipidemia, diabetes, and metabolic syndrome, which would be, the triad I was telling you about earlier. Biliary cirrhosis is an antibody-mediated immune disorder that begins in the bile ducts. Most will have circulating IgG antibodies that are not found in other types. This is seen usually in women over the age of 30. Again, it's a rare metabolic disorder. It's usually genetic, and these women, unfortunately, a lot of them have to have a liver transplant. Epidemiology of cirrhosis. A study done at the SciU University from 2010 to 2012. The study was initiated to see if liver cirrhosis was a major health problem. What they did was they studied everybody that came through their hospital during that 2-year span that had any liver hepatitis or actually cirrhosis. And what they found of those 127 patients, 54 of them were women, 73 were men, and their ages were from 29 to 68. The mean age of that study was 51.8 years old. So again, these are not old folks. 31 had hepatitis B virus, 27 had hepatitis C, 17 had hepatitis B and C, 17 had B and D virus, and 41, the largest number of the population of the study, had alcoholic cirrhosis. Again, alcoholic cirrhosis, all the hepatitis viruses, unless they received them from their mom at birth, could have all been prevented. All those cases actually could have been prevented. It's a disease of the lifestyle with the hepatitis and, again, alcohol, excessive alcohol. Liver does multifunctions of the vital. Our conclusion is it's a vital organ to sustain life. Cirrhosis affects several body systems, and it's a disease that can be prevented by avoidable risk. I hope you enjoyed my presentation. Thank you.